Some women get through their monthly periods easily with few or no concerns. Their periods come like clockwork, starting and stopping at nearly the same time every single month, causing little more than a minor inconvenience. However, other women experience a host of physical and emotional symptoms just before and during menstruation. From heavy bleeding, missed periods, to unmanageable mood swings, these symptoms may disrupt a woman's life in major ways. Most menstrual cycle problems have straightforward explanations, and a range of treatment options exist to relieve one's symptoms. But what exactly causes the menstrual disorders? And what are some of the types? Let's get these and more questions answered on Social Hour.
Now, in studio, I of course cannot talk about this by myself. I have Dr. Timona Obura. He's a gynecologist. He's going to be telling us which hospital he works at. And then we also have Scarlett Gishovi. That's how I know her. But she wants to be called Caroline today. So I'm like, that's fine as well, Caroline. We can go with that. So, Dr. which hospital do you work for?
Aga Khan University Hospital in Nairobi, where I practice as a gynecologist.
All right. Okay, well, thank you so much for making time, both of you, and coming to the studio this morning. Now, we're going to talk about menstrual disorders, but before we even talk to Dr. here, I'd like you, Caroline, to tell us about your experience, because I understand that you've been going through a few disorders for a few years now. So, do you know the one disorder that you have?
Yes, I do. My gynecologist told me that I have hormonal imbalance. I've had it for quite a few years, since I was 15, which makes my periods irregular. I bleed for a much longer time than ordinary girls would do, which is like 3 to 4 days, but mine goes up to a week, which is the least, and sometimes even a month.
You can bleed for an entire month?
Yes.
Are you kidding me?
Yeah.
Wow. And at what point did you then know, I think I need to see a doctor? Did you think it was normal when it started out?
Of course I didn't, but I'm not that kind of person to like want to like tell people, oh my God, I have this problem, oh my God, help me. So I kept it a secret, not really a secret, but I didn't want to tell anybody. But about 2-3 years ago, I had to see a doctor because everything was getting haywire. And I had to go get checked out because my periods were just like off the charts. Yes.
So, like, would you get it only a few times in a year?
It's different. Sometimes I miss it for like 2-3 months, or sometimes I get it for like much longer periods of time. Yes.
And then what did the gynecologist say about what you need to do to treat the disorder?
He told me there's nothing much I can do. All I can do is sometimes just wait for it to come as it can come, you know, or take pills, which are contraceptive pills that can help regulate my hormonal imbalance, or just wait until I have my firstborn child, then maybe things will be okay.
You just said that, you know, you couldn't talk about it with people.
Yes.
And when you started sharing your story, were people now opening up to you too and telling you, actually, you know what, even I have a disorder and it's this and this and that?
Yes, I have a few friends who I've told, and then they're like, oh my God, I've been going through this for years, since I was in high school, since I started my periods, since, you know, for a very long time. And it felt good to share and to have someone you can talk to and really understands the situation. Yes.
And it's very important. I didn't even know there was stigma to that as well. And it happens in so many things that people go through, right, Dr. Ari? You just feel like you're sidelined.
Yeah, right. Yeah, not quite. Actually, I'm very much in connection with the story that Carol has just talked about.
Yeah.
Because this is a common problem, really, what she's describing. It's not a rare problem to encounter at all. In fact, in any ordinary half-day session, while seeing patients, I would expect at least within the next 3 or 4 patients to have a patient who's describing exactly what she has described.
But they just don't know what it is.
Part of the problem. Yeah, you of course, there is a problem. I mean, these are common problems, and women do encounter and live with these problems. In fact, part of the problem is that people make them look like they're normal. So people are encouraged to normalize this right from younghood, and don't worry, it's going to settle. Just like she has told you, wait until you have your first child and you'll get better. Not necessarily. It could, it may not. And there could be other causes that actually need to be handled.
Let's talk about those causes. What causes menstrual disorder?
So just one step backward, even before we talk about what causes this, what problems are they? So you've had a clear description of an irregular menstrual cycle with prolongation of bleeding. That's just one such example. One other example would be pain. Pain is what really brings a lot of patients also to see the doctor. So painful menstruation. And
if I could interject,
yes.
That's also another instance where
yes.
we as women think it's normal to go through cramps, and extremely painful cramps where you have to take the day off from work or you don't go to school because of how painful it is. But it's normal, or that's what we think, and you go back to work. Another instance, right?
Exactly. And you are encouraged to normalize it, and don't worry, things will get better. And then don't always do. In fact, they could get lots worse, and there could be an underlying problem causing, which could be quite debilitating and really, really bad for health. And some of these problems need to be detected early. So other than irregularity, which we have talked about, and pain, which we've talked about, is heaviness of bleeding. So that's a bit different in that most people could be having a regular menstrual cycle, but it's extremely heavy. So a normal menstrual flow would last 3 to 5 days, for example. But there can be flooding to an extent that it's causing social embarrassment. You can't leave. You can't leave your house, you can't go to work, you can't go to school. And this can start from a very early age or can develop later in life. So these are 3 typical, very common patterns that we can talk about. Yeah.
All right, but then for the cramps bit, is it normal, just a little pain? Like, is there any pain that is okay, or you should just not feel any pain?
Yeah, so that's a good question. In fact, pain, so the typical pain is, which we have correctly referred to as cramps, is actually a crampy or spasm-like pain. To an extent, people would normally say, I'm just having my cramps, when referring to an actual menstrual flow. It's because it's a common problem, first of all. So a lot of menstruation is associated with some pain. Some pain, minimal pain, perhaps not quite a big problem. But the moment the pain intensity stops you from normal functioning, stops you from being able to get up and go to work like everybody else, or you find you're taking so much medication to control the pain, then there is a problem that needs to be looked into. So we should not be really normalizing any pain that requires medication to control pain. If it's tolerable and tolerable with minimal medication like Panadol, for example, then you can say, okay, that is minimal pain. Anything that is upscale, and if it's just one day, that's okay. If you're having so much pain, there's a problem. And a lot of this pain differs. It can start actually up to a couple of weeks even before menstruation, or just becoming entirely intensive 2 to 3 days before menstruation, and getting really bad with menstrual flow, and then subsiding towards the end of menstruation. And that's a typical cyclic type of pain. There can be also other causes of other types of pain, which actually can continue. So only getting worse with menstruation, but actually continues throughout the menstrual cycle. So there are actually conditions which cause pain. A very common condition, little talked about, is called endometriosis. Now, people can start having pain right from the time you start having a menstrual flow. That is primary pain. But secondary means it comes later, more than 2 years after onset of menstruation, really needs to be looked into. Endometriosis is a destructive disease. Destructive because it destroys the fertility in women. It actually destroys fallopian tubes. It actually destroys ovaries. It's a reproductive risk. And women like this could end up with infertility. And it needs to be detected early when it starts. More common presentations after the age of 30. But it does happen even in adolescence. It needs to be detected and controlled early, because if it's not controlled, you can imagine the the burden that the woman is going to have to live with.
Yeah.
Infertility for the rest of their life.
Yeah, yeah. And we also have a very close friend to the show in Jambi Mama who has endometriosis, and she was the first person to come out and talk about it and tell ladies it is not normal to have extremely painful cramps. What is the role, not what is the role, but let's talk about fibroids, for instance. That also plays a role, right, in the menstrual disorder. Mm-hmm.
Yeah, in fact, that's a huge disease burden for us Africans, because fibroids are actually present in 20 to 50% of all African populations. That's a wide range. So by the age of 30, if you collect 30 to 35-year-old women and decide to check all of them for fibroids, you're going to find between 1 out of 5 to 1 in 2, on average, having a fibroid at some place. The issue is not having the fibroid, because that is not a disease that is going to spread from your pelvis and go to the chest or go to the brain. That's not the issue. The issue is the problems that they cause. So the focus is, are they causing a problem? Yes, they cause heavy menstrual bleeding, which is a huge problem, especially when they grow into the inner lining of the womb, of the uterus. Very heavy menstrual bleeding. They can cause pain in women. They can lead to spontaneous miscarriage. They can lead to preterm birth and whole complications of premature delivery, and of course they can contribute to lack of conception and infertility. So fibroids, of course, are little round ball-like structures which grow on the uterus, and they are, like I said, benign. They're not cancerous, but the disease burden associated with it is huge for the African population because of the genetic inheritance.
All right. Now, Caroline, you did mention that you had or have hormonal imbalance.
I have.
You have.
Yes.
So what does that do to you?
Apart from having prolonged bleeding, I have heavy flow. So those little cups that you're talking about here cannot help because I have to change my pad every other hour. I can't sit comfortably. I get things called clots. What I don't have basically is pain. I don't get any pain, but it's super inconveniencing and worrying because you have to think about, oh my God, am I going to be anemic? I'm bleeding too much. Oh my God, what will happen when I want to have a child? Oh my God, this, oh my God, that. Can I mess my clothes? It's crazy.
So during that month when now you are going through heavy bleeding, do you go to work? Do you try and stay home more?
Fortunately for me, I work from home, so it's a bit relaxing, but I tend not to go out as much.
Oh, okay, already during that time.
Yes.
What about your moods? Are you okay and pleasant to be around at that time?
Kind of 50-50, somehow pleasant, somewhat not very pleasant.
Oh, so even you know that there are times you're not very pleasant. Wow, okay.
Yeah.
Now, if you're watching this right now, you have a question or two, free